Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking all about hypertension. So let's get into it. So first of all, what is hypertension? I'm sure you've heard of it, right? You're in nursing school, you've heard of hypertension. It means high blood pressure. But let's take it back a sec and think, okay, well, what is blood pressure, right? So blood pressure is determined by the amount of blood that's being pumped from your heart and the amount of resistance to the blood flow in your arteries. So if you have more blood being pumped out and you have narrow arteries, you have higher blood pressure. Blood pressure is represented with systolic over diastolic. So your systolic represents the pressure in the arteries when your heart beats, and your diastolic represents the pressure in the arteries in between beats. So the normal ranges, less than 120/80, that would be normal, healthy, good blood pressure. Pre-hypertension is defined as 120 to 139 systolic over 80 to 89 diastolic. So you don't have hypertension, but we're keeping an eye on you because you might develop it, right? You're pre-hypertensive. Stage 1 hypertension is 130 to 139 over 80 to 89. And then the most severe kind of hypertension, stage 2, is anything over 140 greater than 90. So greater than 140 over greater than 90. So an example could be 180 over 92, okay? So that's stage 2. And this is important that we have these stages because it helps us kind of determine treatment. And when do we need to see the doctor? When do we need to just keep a monitor on it? And when do we need medication? There are a lot of risk factors associated with the development of hypertension. Some of them are modifiable, like your diet. Some of them are not. So I'm just going to briefly kind of touch on them. Things about like your gender, being male, being African American, or being obese. If you have a family history, there's a big genetic component to hypertension. If you have a very stressful life, you have high stress levels all the time, you are more likely to have higher blood pressure. When it comes to your diet, if you have a lot of salt in your diet, you drink a lot of caffeine or alcohol, you don't get enough potassium or vitamin D in your diet, those are risk factors. Your age can be a risk factor, so greater than 65 years old. That is related to like the normal physiological changes of aging. What happens when we get older, our blood vessels become less elastic, which increases resistance to that blood flow, which will increase your blood pressure. Those who are inactive, so they don't live an active lifestyle. They have high cholesterol. They smoke cigarettes. That can lead to vasoconstriction, right? Which increases pressure, which increases the blood pressure. And then certain medications, like prescription medications, like the birth control pill, can increase your blood pressure. And then, of course, illegal drugs, things like amphetamines and cocaine and things like that, can also cause vasoconstriction, which can increase your blood pressure. So what are the signs and symptoms? Aside from the big one, right? You take their blood pressure and you get the reading and you notice that it's high, right? In addition to that, they might also present with things like headaches, nosebleeds, blurry vision, chest pain, an increased heart rate, and then their pulses might be +3, +4, so very easy to find those peripheral pulses. So when do we need to get screened? If you are a healthy 18 to 39-year-old, the recommendation is you get your blood pressure taken at least every 2 years. Most people should probably get it done before then, right? You should have an annual physical where they take your blood pressure, but they say at least every 2 years. And if you have any risk factors or you're over the age of 40, every single year you should have your blood pressure reading done. Hypertension is going to be one of the most common conditions you will encounter with your patients. So some important nursing interventions include education, right? So if we know about some of those risk factors that are modifiable, educating them about those. So things like stop smoking, smoking cessation, exercise, weight loss if they're obese. The DASH diet. So this stands for dietary approaches to stop hypertension. So this can include things like decreasing sodium, alcohol, caffeine, and increasing your consumption of fruits, vegetables, things that contain vitamin D and potassium. Some labs the nurse might have to draw. You might want to get a CMP or a UA. This is going to help us assess the organs for damage, because people who've had long-term hypertension can start seeing it affect their body. So they can start seeing it affect their organs, and that can be present in organ damage. And then, of course, the big one, lots of meds. So medications can include things like diuretics and beta blockers. These are probably going to be the first line of defense after dietary lifestyle. Usually, unless it's very, very high, like stage 2, they're going to recommend dietary lifestyle changes. They're going to monitor you for a couple of months and see if there's any improvement. And if not, that's when they're going to start thinking medications. So they'll probably start with like a thiazide diuretic and a beta blocker. Other meds they might try: ACE inhibitors, ARBs, and calcium channel blockers. And I actually have other videos I'll link below on these medications. When it comes to complications from hypertension, you want to remember the 6 C's. So the first C is coronary artery disease. The narrowing of the blood vessels leads to coronary artery disease. Chronic renal failure, so the blood flow to the kidneys, they're not getting enough blood flow, it's not adequate. CHF, congestive heart failure, can lead to, the heart not working as well and not pumping as efficiently. Cardiac arrest, so like a heart attack, your heart stops working. A CVA, so a stroke, again, related to coronary arteries disease, the narrowing and thickening of the vessels. And then hypertensive crisis. A hypertensive crisis is defined as having a blood pressure greater than 180 over 120. So this is a medical emergency and needs to be taken care of right away. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.